As we face yet another COVID surge, we have to talk about the toll this pandemic is taking on our healthcare workers. They are working extraordinarily long hours over months and months under emotionally fraught conditions and in often harrowing circumstances. Today, I'm talking to Lacy Lancaster. She wrote an astonishing post on Facebook that went viral about her experiences as a critical care registered nurse at Ocean Springs Hospital in Ocean Springs, Mississippi. She has worked in the COVID ICU unit since the pandemic started, has been a nurse for 13 years, and she's the single mom of 2 girls. Lacy, thank you so much for taking the time to talk to us.
Oh, no, thank you. It's great to be here.
So I read your post and I thought I knew what was happening, but it sort of brought it home in a different way. I wonder first, I mean, it was, you just described it sort of like a horror movie. I want to know, how are you doing?
Mentally, I'm okay. I've been dealing with COVID patients during the pandemic, obviously, since it started. And every day is a little bit different. There are days that I laugh, there's days that I cry. And, there are days that I come home from work and literally have to pull myself back up off the floor. But for the most part, I think we're hanging in there,
I wonder, what's it like at the hospital right now?
Chaos. I mean, to say the least, it really is. Our hospital is only about 120 beds, and we have two other hospitals in our hospital system, but we're just seeing things that literally are giving some of us nightmares. 3 weeks or so, we actually had a good break. We saw maybe 2 patients in ICU with COVID, and we were all kind of just this big sigh of relief, like, wow, we're getting a little bit of a break, and a mental break, a physical break. And then out of nowhere, within a week, when I wrote that post, we went from having 2 patients to having 8 to the next night, we were all 12 of our patients were COVID positive. And my last night that I came to work, I, parked where I always do. And when I walked up to the building, that's why I said it seemed like a horror movie. I mean, there were people everywhere. And the ER was packed, and there were people sitting in their cars. When people are coming in, there's nowhere for them to sit. So they are giving them their cell phone numbers, and they're going to sit in their cars. And, we have grassy areas out, in the parking lot. People were just kind of sitting there waiting to get in. And I'm like, oh my gosh. And I could just hear people talking like, oh, they said it could be 5 hours before we see anybody. And I'm like, and then I get upstairs to my unit and found out there was over 60 odd people waiting to get in, and our ER cannot take that many people. And, and on top of that, over a dozen of them were boarded in the ER waiting to get beds, not only in the ICU, but in our other like COVID floor unit and just general beds as well. And it was just, it was horrible, and helicopters are flying in, bringing patients, and ambulances are coming in, and we have to have beds open for ambulance patients. And so there were people in there waiting 14 hours for things, and it was just like it was not this bad last time, the last time that we got our big first wave in the summer. So it's crazy.
First, I want to pause and thank you for your work and for what
thank you so much
throughout this pandemic. I mean, I imagine you don't get thanked enough. You're doing this, behind closed doors where people don't see in the public, but there is so much gratitude for what you do every day out there in the country, even if you don't get to feel it yourself all the time.
Thank you. Thank you so much.
And I assure, you're in the middle of dealing with all this. So there's a certain amount of toughness we have to bring when we're dealing with challenging situations. I'm curious, what percentage of the people you're treating at the ICU are unvaccinated? And are they saying they wish they'd gotten the vaccine?
Yes. As of right now, well, I should say right now, when I got off a couple days ago, all 12 of our patients that we had in our unit were unvaccinated. And 10 of them out of the 12 were all on ventilators. And many of them before getting on the vent, we're even asking them, is it too late to get the vaccine now? And why didn't I do this? And, what's really sad is these are young people. Our first couple of waves were elderly, people with a lot of medical history. We're seeing the majority of our patients right now are in their 30s and 40s, not vaccinated, hardly any health history. I took care of a girl the other night. She was 25 years old. Yes. And I've actually had them grab my hand and squeeze so hard saying, why didn't I get the vaccine? And, I had a girl not too long ago saying, please do what you can. I have children. And it really pulls at you. And as much as I push people to get the vaccine, there's only so much we can do.
You said earlier that this was worse than the first COVID wave. Is that in what way? Just the sheer numbers?
Yes, the numbers. And just today, I read earlier, I think the state of Mississippi had its peak positives. I think we hit 4,400 in the entire state and around 1,000 or so just here on the coast. And beforehand, we were learning a lot about this. People were quarantining. This was before the vaccinations, and people were playing it a lot more safe. So we would have waves of patients come in, but we did not have nearly the amount of boarders in the ER. We have all these people down there that are intensive care patients that can't come to us because we don't have the bed for them. And that's what's making it worse, is that it just kind of hit us all at once. And as prepared as we are as a healthcare system, you can't prepare for an influx of patients like that are all COVID positive and all need our help. And we just don't have anywhere for them to go.
So what does happen? I mean, you described 60 people who needed care that night. You couldn't take them all. Where do they go?
They sit in the ER. We actually had the ER doctors were going into the lobby and triaging patients. They were doing x-rays on patients in the lobby. They were giving medicines. They were bringing people oxygen tanks. And I mean, there was a young girl sitting down there literally with the highest amount of oxygen you can get from an oxygen tank, just sitting in the lobby, barely able to breathe. And we're like, we don't have anywhere to put these people. And, there are some people that sit down there that not necessarily are COVID or might be, but they're not that bad. And the doctors are having to come out there and be like, you just need to go home, And for the ones that are very critical and need a place to stay, they're literally just taking beds down there. And, the ER staff is inundated, having to take care of them. That's not what they're used to. And they're, really pulling out all the stops down now. Sometimes I think the ER is the rock stars at our hospital because they're being put through the ringer right now.
I have 2 ER docs in my family, and so I know the work they do. Yeah,
it's really you're probably hearing it. Yeah, there's extra doctors that are coming in. They're picking up extra shifts to just come in and help triage patients. And I work night shift. In the middle of the night, the ER kind of starts out busy, and then it tapers off until sometimes there's only 4 or 5 patients in the ER, and now there's still 30 to 40 of them in the morning when we get off, and and a lot of them haven't been seen yet, and doctors are coming in on their off days to come help out and take care of people.
So how long is the wait if they're there overnight like that? Could they be waiting 12 hours
for a bed, or just to be seen?
To be seen.
To be seen, yes. There's people that have been down there for minor care issues who we've seen wait times 13, 14, 16, 18 hours. And then there's sometimes people who are waiting for beds that have been down there for 3 days.
You mentioned earlier that some doctors are coming in on their off days. It sounds like a grueling way to live right now. Can you tell me a little bit about what are your hours and what is a day like?
I work strictly weekends and night shift. I've been doing that for about 5 years now. So, I usually come in on Friday night, and I work overtime every other week. So I'll work every other Monday. And a lot of people are picking up 5, sometimes 6 shifts a week, just to kind of help out. But it's literally, you walk in the unit on Friday night and you're off, and half of the time you look down and you don't even realize what time it is. You don't get to sit down much. The other night, my patients that I had were so busy that I just kind of sat right outside their room, to take care of their medications on their IVs. We keep their IV pumps in the hallway. We have extension tubing that goes in the room so we can manage all their medications, and we keep the ventilator screens outside so we can do all that there. But I mean, I'm literally sitting there trying to chart, fixing a machine, and it's just nonstop. And I just got off of doing a stretch of 4 and it was exhausting. I think I slept for about 18 hours when I got home the next day.
So you're not going in the room at all? You do
We
all
do
the
go
work?
in.
You do go.
We do go in the rooms. When we do go in the rooms, we try to limit how much time we are spending in there. And of course we have to gown out, and we have to wear the N95s and, protective eye covering. And it's a process just to go in and out of the rooms.
I've heard stories that people sometimes are on ventilators texting on their iPhone or on their iPad. Is that true? Perfectly alert.
Yeah.
They know what's.
Oh, yeah. Most of ours, not so many of our COVID patients, because we really do keep them under a lot of sedation. Like I said, so their lungs, they're not working a lot. But yeah, a lot of patients who are about to, get off of the vent, we turn them down on their vent to a setting where they're doing a lot of breathing on their own. And yeah, they'll be in there flipping channels and waving at people when they walk by. Those are the kind of vent patients we like to see, because that means they're one step closer on getting out of there.
I'm curious what message you'd like to give people who still hold to that view and don't know what's going on in the ICU.
There are many times I said, I wish we could have a live broadcast in the unit. I wish people could see what goes on behind our locked doors, just to walk through and see every patient on life support and on multiple medications. And, it's just like, oh, I wish we could do that so bad. And, unfortunately we can't do that. And people just have to kind of take our word for it. And I mean, I've had people backlash at me and say, oh, that's not really happening. And I'm going, well, yes, it is. I'm working it every day. This is my life. And I'm seeing what's happening, and people still refuse to believe it. And it's like, I don't understand. I just can't understand how.
Doesn't that make you feel, I don't know, it's crazy making, like you're living this reality and they're denying it.
Yes. And, our hospital system, we post every day on social media what our numbers are, how many patients are on ventilators, how many patients have been vaccinated, and people will still comment and go, this is fake news. And we have no reason as a hospital system to go on and report, falsities. It's like, no, people, pay attention. This is really what is happening in our local community.
Has anybody quit the profession? Just burned out?
Not the profession, but unfortunately, we've had a lot of people who have resigned, and a lot of them have gone traveling. Most of them that have gone to travel are still in intensive care, but people needed a break. And actually, I think this week we got a couple more leaving, and it's hard to see, and it's hard on them because they don't want to leave. They don't want to leave their work family, but for their mental sanity, they, I would never, disagree with anyone on their right to choose to do something different, because mentally, you can only take so much. And I'm seeing a lot of nurses wear down, and if that's what they have to do for themselves, then, that's what they need to do.
Well, I don't know how to thank you enough for the work you're doing and for going in every weekend, despite all of it. And thank you for making it public and doing your best to let the world know what's happening.
Absolutely. Thank you so much for letting me, speak what I could.
Is there anything you'd like to say as a message to people?
Definitely. Please, just get your vaccinations. And I hate to, preach that on people, because people do have their reason for not wanting to get the vaccine. But if not, please protect yourselves. Please mask up, please social distance, stay away from large groups of people, wash your hands, and just think about your loved ones. Think about your family, think about your young children who can't get it. Think about your elderly family members who, need to be kept far away from this. So just please, everyone, protect yourselves and your families.
Lacy, thank you.
Thank you.
Hi, I'm Jessica Yellin. If you like this video, please click subscribe, and you can click the bell to get notifications when we post new content. Thanks for watching.